Today we will discuss about why does the tooth hurt even after a filling. You finally got your cavity filled, but now your tooth hurts even more than before. Did your dentist make a mistake? Did the filling fail? Or is something much more serious going on? The truth is, pain after a filling is surprisingly common. But here is the catch. Sometimes it's completely normal, and sometimes it's a warning sign that you should not ignore. In this video, I'll explain the real reasons why a tooth can hurt after a filling, when you should stop worrying, and when you should immediately visit your dentist. Hi, I'm Dr. Gaurav Poplai from the Dental Arch Bandra West. Every now and then we see patients who come back saying, "Doctor, my cavity is filled, so why is my tooth still hurting?" Let's understand what's actually happening inside your tooth. Let's start with the big myth. Many people believe that once a cavity is filled, the tooth should instantly become pain-free. Unfortunately, that's far from the truth. Think of it this way. Imagine you have cut your finger deeply. Even after the wound is stitched, it still remains sore for a few days till it heals. Your tooth behaves in a very similar manner. During a filling procedure, the decayed portion of the tooth, which is known as the caries, is removed, but the nerve inside the tooth may already be irritated because of this decay. The nerve needs time to recover. Here are the 5 common reasons for pain even after a filling. Reason 1. The filling was deep. If the cavity was very close to the nerve becomes inflamed. This inflammation can cause sensitivity to cold, sweets, or pressure for a very few days or even a couple of weeks. This is usually very temporary. Reason 2. Your bite is too high. This is one of the most common reasons for post-operative pain after a filling. If the filling is even slightly higher than your natural bite, every time you chew, the tooth is subject to extra pressure. Patients often describe it as, "Doctor, it only hurts when I bite." This happens because the tooth with the filling touches the opposing tooth before the other teeth while biting. The good news is, this usually takes a couple of minutes for the dentist to correct. Reason 3. The nerve is already damaged. Sometimes the cavity was so deep that the bacteria has already reached the nerves and the blood vessels in the tooth, even before the filling was actually attempted. Initially, the filling seals the cavity, but over the next few days, the nerves continue to deteriorate. In such cases, the tooth may eventually require a root canal treatment. The filling did not cause the problem here. It simply couldn't reverse the damage that had already occurred. Reason 4. Sometimes the tooth has tiny micro cracks that are invisible to the naked eye. After the filling is attempted by the dentist, these cracks become more noticeable because of pressure during chewing. This often causes a sharp shooting pain when biting. Reason 5. Normal healing. Some patients experience mild sensitivity to cold drinks or hot beverages after a filling. This usually settles down within a couple of days as the tooth adapts. Mild discomfort is normal. The severe pain is not. When should you worry? You should contact your dentist immediately if 1. The pain is getting worse by the day. 2. You cannot sleep because of this pain and the pain is actually increasing while you lie down. 3. Your face begins to swell. 4. The tooth hurts even without eating. And 5. The pain continues for more than 2 weeks. These are signs that the nerve may not be healing and further treatment is necessary by your dentist. What you should do. Don't ignore the pain after your filling. and don't keep taking those painkillers every day. And definitely don't assume the filling has failed. A simple adjustment may solve the problem, or if the nerve is infected, early treatment can save your tooth from much bigger complications. Remember, pain after a filling does not mean something has gone wrong. Sometimes it's simply your tooth healing. But the key is to knowing when it's normal and when you need to seek help. If you have recently had a filling for your tooth and if it still hurts, we'd be happy to examine it. Visit us at the Dental Arch Bandra West, where we use advanced diagnostic techniques to identify the exact cause of your pain and provide the right treatment. If you found this video helpful, don't forget to like, share and subscribe. And tell us in the comments, have you ever experienced pain after filling? We'd love to answer your questions.